right. So you guys know that what I wanted to do was just go over the program, how it started, where we've gone with it, how far we've got, what we've done, and where we might go in the future. And I would love input on that as well. Now I'm just going to chat away. And this was a picture that was provided to me by SCI BC that was supposed to represent the program when I started it. And this is the program.
There's some good
So
looking guy there.
I've written down sort of why I started the program. Started the program to try and assist others to manage the specific changes that come with aging related to SCI as a result of my own experiences. So what happened with me is that when I hit 60, I was hurt when I was 17 years old. So I've been in a chair for 53 years now, I think. But when I hit 60, I blew out a shoulder by making a dumb transfer.
Yeah.
And then I started to get some skin problems as a result of transferring badly.
Yep.
And then, they diagnosed me with sleep apnea, which I ignored.
Yep.
Don't do that.
Yeah, so all sorts of things happened. They put me on antibiotics for a long time and I had huge bowel problems. So I've fixed all those things. But when I was offered the job at SCI BC, Chris actually said, "What would you like to do?" And I said, "Well, can I do something on aging and try to help people plan for it and adapt to it?" And he was very keen. He said, "Yeah, let's do that." And part of the reason is that now, I've been in a chair for 53 years, but I was told almost throughout my lifetime that I would only live to like 55 or 60. Well, I'm 70 this year. So it's going to happen. Individuals with SCI will we're going to live longer, and it's going to create increased demands on the system that's in place. And I don't think the system has prepared for this.
No.
And the reason we're living longer is because we have way more recreation options. We're healthier. The medical system has improved. There's all sorts of things that have changed. The chair designs have improved. Like I can't identify one thing or another thing, but so many things have changed that we're just going to live longer. We're going to be healthier. I think our lifespan now is probably the same as somebody else. So what I did was I didn't know how to start the program or what we might do. So I sent a survey out, and I don't know if you guys got this survey, but I sent it out to our membership database of people with SCI that were over 45. I don't know if you guys got it, but I did send it out to that database. I got over 100 responses in the first week, which of course I know nothing about surveys and Zooms and all that stuff at this time, but I was told that was really, really good. So I developed a list of priority concerns for either support or education. And the survey questions were like prioritize the issues. So there was a list of issues. I'll show you that in a minute. How would you like this presented? Preferred times. You're never going to get a perfect time for everybody. Is having an expert important? And is having a peer important? And then would you like a discussion group focused on the issues of aging with SCI? That's a very brief sort of description of what the survey questions were about after you prioritized the issues. So here's a list of the issues. And this actually surprised me in that the issues that came out as the priorities, the most, you can see the bars on the outside show how much people wanted information about those issues. And they're basically the same issues as when you're first injured. So it's like there's a few that add in there, like care options, and there's some that uh, don't get addressed until you get older. But what happens is just the issues change. So you have bowel and bladder issues when you're, 25 years old and you have an injury. But when you get to 50 or 60, those issues might change, but there's still the issues. So what I did was I went through the way these issues came out. And if you look at them, I think we have had an expert presentation on all of them. And some of them we've even separated into two, like bowel and bladder, we did one each. We didn't do it as a combined. So that's what I did. What came out of the survey was we developed some support info programming around the priority concerns. In other words, we started a monthly online discussion group to further clarify the concerns. So we have this discussion group, which you guys have all been on, and I try to figure out what we do next, or I tell you what I think I'm going to do next. So I had that survey available to me all the time. So I always had another option for a presentation of an expert telling us and a peer. There's always peers, like we're always there, and I always make sure we have lots of time for questions. I've been getting 15 to 30. It's been going down a little bit lately, like 10 to 15, maybe 20 participants on all of the discussion groups. And then the ed sessions, when I started, they were 20 to 30 participants each session, but it's gone down to about 15 to 20 now. And we did an educational session on basically all of those issues that were identified. So that's a 45-minute presentation with somebody, as well as having peers involved at the end, that's an expert on what we were talking about, like wound care or skin care. We had a nurse and a physio. Pain, we had a peer, a guy in a chair who was an anesthesiologist when he was hurt and became a pain specialist. For bowel, we had the ostomy nurse from VCH. So we got people, or I guess I did. I got people that would be able to provide information that you wanted, and they provided what we might not have already known. So we also, at that point, we also developed an Aging with SCI section on the SCI BC website. And after each session, because you can never get a time that is perfect for everybody to come to the education sessions, we recorded them all, and they're all available in the Aging with SCI BC website in that aging section. So they're all there. It's kind of difficult to get to it, though, and I'm working on changing that. In that you have to go to the SCI BC website, and then you have to go into peer programs, and then you have to go to the aging site, and then the videos are there. So it's kind of a four-step process, which I think is a bit cumbersome. So I'm working on changing that. So that's what we did. These are the topics we covered. I've gone over, we covered everything. We did bladder management, we did shoulder care with a physio, we did bowel management we did pain management, we did mental health. We did care options with Paul Gauthier. We did skin and wound care. We did osteoporosis with some experts from Toronto. We did power assist mobility devices with Dr. Jamie Borisov. We did physical activity, and physical activity was the second most wanted presentation. We did some finances and we did travel. I think that's the majority of what we did. And the web page actually was getting a lot of hits. Like these are like monthly, 189, 195. That's pretty good. So I don't know if it's still the same. Again, I think it's probably gone down a bit. And then after about a year, I thought, okay, I better do an evaluation of the program to see how it's doing and see if I can make any changes or if any real big changes are recommended by the people that are involved. So we did the survey, another evaluation survey, and everything turned out really, really well. Everybody was appreciating what was going on. There's always a couple outliers, but you can see that the little blue ones that were poor are like one person had an issue with the discussion group, or one person had an issue with the education sessions. And I think that it was mainly because of the timing. Yeah. So that's kind of what happened, and what the evaluation showed me. So now I've gone through all these things, and I'm figuring out what to do next. And one of the things that we're gonna do, or that I want to do, is share all that information that we've developed and that we've had sessions on, and make it easier to access. And then maybe develop some partnerships so that we can address some other stuff. I'm not sure we're doing this sort of offhand with the cost of home care services and trying to develop partnerships with seniors groups. And then I'm going to do a mail out to the total SCI membership instead of just everybody that's over 45, to attempt to inform more potentially younger individuals about the program so that they can actually access the videos if they want to, or come to the discussion group, or come to the ed sessions, so that we're actually talking to people that can plan for this or adapt to this, which was the original intent. Most of us were either already going through it or we've gone through it, kind of thing. So it's always been a little bit of a potential to get some younger people involved. So the mail out to the whole membership is going to maybe do that. And then I'm going to change the title of the program to The Road Ahead instead of the Aging with SCI program, because the word aging tends to scare people away, especially the younger folks, because they don't consider themselves as aging. So what I really learned is the big one was the biggest concerns that we have are not that different throughout our whole sort of span of time with the spinal cord injury. Uh, the participations level are still pretty high, and we get interest all across the province. That's the other part that I really appreciate, is that the whole Zoom thing has opened up all this stuff to anybody from anywhere. So people can come from Kelowna or Ladysmith, anywhere they want to come from, they can still come. Initially, and still, I have trouble sometimes finding clinicians who are willing to do these ed sessions. Again, because as soon as you say the word aging, they think they're not experts on aging, which is probably true, but they probably know more than anybody else. And there basically aren't a lot of experts on aging, because we're the first group of people that have actually lived this long. So we're like the experimental group, I would say. Uh, and you know, there's some barriers to like adequate health care for us, because they haven't prepared for us to live this long. So aging is a significant issue for us, and it's still somewhat unaddressed by the health and social support systems that we live with. We're living longer, and our support systems currently aren't designed for disabled sort of adults' needs. We have to do our thing in advocating for change, which we've done all our lives. And we still have to do it, because now we have to change it in terms of living longer. So I wrote down a bunch of stuff about what we need to do. The needs of people with SCI and similar disabilities change in older adults. Our systems need to prepare, because home care services should be reviewed and increased to avoid costly and unnecessary long-term care placements. Because even now, some people are put into long-term care because they can't afford home care, or it's not available where they are. And long-term care facilities cost a lot of money to the government, and they're not. I mean, they're not the most comfortable environments either, in many cases. Community nursing services will see increasing demand as we age at home. If we can get home care services, we might have issues like wounds or small things that can be fixed that nursing will need to address. So they're going to have to get more people. User fees for home care will need to be reviewed, updated, and revised to accommodate the increases in cost to maintain a quality of life for people with disabilities as they age. So home care is charged, the costs, the user fees for home care are the same whether you have a disability or not. So there's really no consideration taken for the increased costs that you might have as you get older. You might need a power chair. You might need a overhead lift. You might need a van that you can get in and out of. And these things all cost a ton of money. But the user fees for home care are not adjusted as a result of that. And then the tax system, I think the tax system will allow you to deduct a lot of stuff as medical expenses, but I think it's going to have to allow you to adjust more because it's just gonna keep costing more. So those are I'm wondering if people are thinking of other things that need to change, but I'll ask that in a minute. This is other stuff that we did that I didn't focus on at the start because they were kind of offshoots. We did a partnership with the UBC Research and SCIR, which is Spinal Cord Injury Research Education. So we developed 4 videos with those guys, including they did bowel management, physical activity, bladder management, and pain, featuring the experience of people living with SCI along with available clinical evidence. These videos are also in the Aging with SCI section, but they're also on the SCIR website, which is a worldwide website. And these videos were very professionally done. They're not like ours where we just record, edit, and post. These were, done with professional photographers and the lighting, all that kind of stuff. So they're a bit better quality-wise, but a little less detailed in information because they can't make it too detailed in that situation. We're doing individual advocacy to improve access to home care services in light of all the higher costs, etc. We have a program that is still going on called Life After Tampons for menopause. It's monthly Superior Port Education online group. It was started in March of 2024. It's run by Terry Thorson, another of the staff at SCI BC, and I think it's still going on. And then creating more methods to inform more individuals with SCI about this program. So those are the other things that we've been doing. Yeah, that was it. So I will quit screen sharing this and see what people kind of think.
I think you nailed it on the head.
Well, it was fun and it wasn't easy at times. Like getting the presenters was a bit difficult at times, trying to convince them that they were the experts when they didn't think they were.
Well, number one that you mentioned, Doug, or anyways, about older people.
Yeah,
A lot of us older people, we're not being taken care of properly.
I know. And that's part of the whole system, eh? We have to advocate for ourselves to get taken care of properly. And that's part of what the program is about.
Like we're told when you get to a certain age, we don't do this for you anymore. We don't do that for you anymore. We don't do that. Well, that's
Yeah.
crazy.
Well, and a lot of services have been withdrawn from home care and replaced with programs that are actually voluntary and don't exist in some places and do exist in others. It's very interesting what the provincial government has done. Hang on.
That's because we're not useful to the future.
Yeah, we are
Well,
expendable now.
Yeah, exactly.
I'm not sure that's their reason, but
That seems to be the attitude of a lot of medical professionals, though.
Yes.
well,
Yeah.
I think they're just not prepared. I think they're
No,
not.
no, I disagree, Doug. I disagree very much.
Okay.
Me
I
too.
get the impression quite often that we're just why bother with us?
Huh.
Yeah.
That's what I'm getting. It's from a lot of doctors.
Yeah, I wonder. I don't get that very often.
Well,
Well, I don't remember getting it at all, really. I think the only time I ever got that was when I went to a surgeon around shoulder surgery, and basically he told me, "Well, you're 60 years old and it might not hold, so I don't think it's worth it."
I was told that about 10 years ago because of my spine. I've
Yeah,
got popped disc and crushed disc and a fusion,
yeah,
and more discs are popping and all the rest of it. I've shrunk about 4 inches because of it.
yeah,
And they said, well, there's nothing we're gonna do for you.
Yeah.
yeah. Well,
You're older. It doesn't matter anymore.
okay. Yeah, it does suck. That if that's what you're getting,
Yeah, definitely.
that does suck. And was it a physiatrist that told you that?
No, a surgeon,
Oh, yeah.
orthopedic surgeon.
I wonder if you could get a different opinion from another one.
They're all in the same office, trust me, and here in Surrey in the medical building. They're all in the same one big office with eight orthopedic surgeons. So
I mean, the only thing I could recommend for you would be to maybe go through Blessum, go through the SCI program.
I would
Through,
love to, but I tried to contact them about 2 weeks ago. I ended up talking to Bert up in Cowichan River there, and we just talked about medications.
that's all I could recommend is maybe get a hold of Blessum. See if you can get a physiatrist to get you to an orthopedic surgeon that's used to spinal cord injuries. Like that's the other
Yeah,
thing, is that your orthopedic surgeons, whoever they are out in Surrey, are probably not used to dealing with spinal cord injuries.
yeah. I don't
So
think they are.
I think it would be to your advantage if you think you need to get a hold of Blessum, get to a physiatrist, have them recommend an orthopedic surgeon to have a look at you and see if that changes anything.
I've asked my family doctor many times, and nothing ever happens.
Well, they
Because you
should be
can't, you
your
can't, you can't talk, you cannot contact a specialist on your own.
no, you have to go through your family doctor.
Yeah,
Yeah.
that's the problem.
But your family doctor should be able to get to Blessed.
My family doctors never referred me to anybody unless I told them who to refer me to.
Right. Well, that's
Well,
because they don't know how to
that's
deal
what
with
you
it.
do then. You go to him and you say, "Can you refer me to the SCI program at Blessed?"
Yeah, but first I got to find out where that program is and who that doctor is.
You can't name a doctor because there's a number of them.
Yeah,
And what they do is when you get into the program, they assign you to a doctor. Does anybody know
yeah.
anything else about that? I think that's
Marnie would know
it.
more. Like she goes there all the time. I don't know if
Yeah, so
she's
do
on.
I.
Is that Marnie and Kim?
Yeah,
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 I know Marnie.
yeah. Marnie, she goes there all the time.
I got to talk to her.
Yeah, yeah. She'll know. So,
Yeah, thank you.
yeah,
Well, you know what? We get most of the advice we get is really good when we get it from other people with SEIs.
yeah,
Yeah, because I'm in pain 24 hours a day, day and night.
Yeah,
yeah.
you should check and see if you can do anything with Blessing.
Yeah.
Because I just wonder if it's just because your surgeons that you're talking to just aren't comfortable dealing with the spinal cord injury part of it.
They don't want to be.
Well, yeah.
Yeah, I had that issue well for a while now, but my doctor really didn't. She's trying to do her best, but her tables aren't set up for me or anything, and she
Yeah.
thinks, "Oh, you just come down there and we'll lift you up the table." No, that's not going to work. But I phoned GF Strong for this other issue for personal stuff, and they told me to reach out to the women's clinic in Vancouver because they're all set up for the disabled.
Oh, okay.
Yeah, so that was really good. So I got in
And
touch with them.
did you do it and did it work?
Yeah, yeah, because they're all set up there for different, like for gynecologists and that. They're
Yeah.
all set up over there at the women's hospital
Yeah.
for disabled and
Oh,
maybe
that's
people
good.
that have been raped before, all these different issues that people have.
Yeah, okay. That's good to
Yeah,
know.
so that was good to
Very good to
know.
know.
Yeah,
There's
Hey,
another situation when they send out these surveys, even through the I'm not sure if it's Spinal Cord Institute, but after a certain age, they don't want you to respond to them.
Oh, they've got age restrictions.
Yeah,
That's research parameters probably.
Yep.
yeah, but we are the older people. They should be desperately wanting to know, but they
Yeah.
just don't want to.
It depends on what they're doing, what research they're doing.
Often with everything. The
What was
access
that?
to women's
Somebody's
hospital
some,
is available to people with disabilities. You just have to have a referral there and they do biopsies and check everything out. And you don't have to go as a woman, you don't have to use stirrups. They do everything when you're lying on your side.
Yeah.
okay.
It's well
Good to
worth
know.
it. It's a long way
Anybody,
to
did
go.
anybody see, or can anybody identify a topic or two that in my first 18 months to a year that we haven't addressed?
How about fatigue?
Oh, okay. That's a good one. I'm wondering who I would get to do it, but let me worry about that.
Yeah, because when like I don't know about the rest of us, but with me, I have a lot of fatigue.
No, that's an aging thing too. It
No,
doesn't
it's a
help.
pain. It's the pain that does
Yeah.
it.
Oh, that too. Yes, I hear you there.
Well, there could be a number of reasons. I mean, there could be tons of reasons.
Yeah.
Yeah.
I know I had a lot of fatigue at one point, and it was because of the sleep apnea.
Yeah,
Wow.
I'm on a machine every night.
So I wasn't sleeping well. So in the
Yeah.
middle of the day, I'd get tired. So
Yeah.
fatigue, okay, that's great. Okay.
Something.
Anybody else?
I said,
I really like the idea of the reaching out
it's
to
not why
broader
I die.
age base
Yeah.
and calling out the road ahead. I think that's great. The thing I'm wondering about is rather than individual advocacy for home care and long LTC, whether we can do something collectively if we can meet the right people.
Well, I maybe I didn't explain it right, but that's what we are doing.
Oh,
What
okay.
we're doing, I have a group right now. I have a group of about 6 or 7 that are all connected to different groups. Like Paul Gauthier runs a care options
Right.
company. Myself from SCI. There's a couple other people from SCI. There's Marnie and Kim from
Okay.
South
the
Fraser,
South Fraser Active
yeah.
Living, and I've just done I've just done a kind of recruitment note, a one pager on what we're trying to do, and we're going to send it out to all the seniors associations that we can find to see if they will support us. And I'm in touch with a politician who's in the government right now. Is a NDP. She's my MLA.
Okay.
And she's aware and she's keeping in touch with us to see what we're doing as well. So I think we're getting there, and I definitely get that point that we need to get some other people involved, because if we go individually, nothing's going to happen.
Right.
But if we can get the other thing that we had to think about was, like, our issues are a little different than people with just senior citizens,
Yes.
but
Yes.
at the other end, they're the same. In some ways they're the same, in some ways they're different.
And you're saying in other provinces, there isn't the charges.
No, in at least 4, and I'm not sure about Quebec, could be 5, and one of them's Ontario. There's no charge for home care.
Hmm.
So what's happened? The other thing that we're probably going to do, and I have to work hard on this to figure out how to do it, is write to the federal government, because they provide the transfer fees, so they provide the money
Right.
for the provinces to provide health care. The provinces make decisions on where they're going to put that money. But I know that the feds probably have some parameters around that, in that, you have to put this much into emergency services, or you have to put a certain amount into, doctors, or, all that kind of stuff, and see if they can make it so that when they get the transfer fees, home care has to be free.
That's a
But,
good point, because some people have money, some don't. And when you
oh,
have,
exactly.
and those of us that might have some money, oh, we got to pay for everything. And pretty soon we don't have the money.
Exactly. Oh, Pete Chisholm has his hand up. Go ahead, Pete.
And stop me if you guys have discuss this. I'm not in on every session, so I don't
Yeah.
want to grab that. But anyway, one of our peers, a man named Andy Caswell, is advocating the provincial government to cover the costs of catheters, in particular the sterile use catheters. And they're very expensive. Some people have coverage, some people don't. I think it's catheters for free. He's got a website set up. And he's doing exactly what you're talking about with regarding home care.
Yeah.
Get this covered. And the approach that I think he's taking, if I understand correctly, is making the case that this keeps people healthier, keeps them out of the hospital,
Yeah.
less expensive to the government.
Exactly.
That's gonna ring the bell that they need, if it's less expensive. But to your point, Duncan, single voice here and there isn't really going to do it.
No.
It's a pretty well organized advocacy effort. So I'd encourage folks that are affected by this, or even if you're not, if you know somebody, share it around, connect with your MLA, and let's see if we can, make a difference there. But anyway.
Kind of like Tim Egger, who always says, do we have to pay to pee?
What was that?
Tim Egger always says, why do we have to pay to pee?
Yes, that's the catheter thing. Yep.
Yeah.
Exactly. And I think that's a line that he's using, but I'm not sure.
It is.
Yeah.
Yeah.
Okay.
I'd like to bring up another subject.
Yeah, go ahead.
MRIs.
Yeah.
Not every MRI technician interprets the MRI the same as a previous MRI technician.
Uh-huh.
And I found that by looking at some of my MRI results over the past few years. And one will say one thing, and another technician will say something entirely different. And it just amazes me how they can't interpret the subject both the same way.
Okay. I'm not sure we can do anything about that.
No, but it's just an interesting situation.
Yeah.
And I
I'm
imagine
pretty
some others have come across that as well, either with CT scans or ultrasounds or whatever.
I've had a lot of CT scans and they've all been interpreted, as far as I can tell, properly. I don't know if they've been interpreted exactly the same, but they've all been interpreted properly. The CT scans have basically saved my life. Anything else that people want to chat about?
Did you have to wait a long time to get one?
I had
Well, what I do is I know that Mount St. Joe's is a small hospital in Vancouver, and they have a CT scan machine that a lot of people don't know about. So I just ask my whoever needs the CT scan, like the doctor, to refer me to Mount St. Joe's, and then it happens fairly quickly. But I can give you an example, Ross, of something that's just happened to me recently. I got a call from UBC CT saying we need to book you in for a CT scan. And I'm like, for what CT scan? I don't remember a CT scan. And it was the CT scan request was put in January of 2025. And they're calling me now. And it's a CT scan that I said, well, I've got an appointment with that doctor in 3 weeks, so I'll check and see if I still need it, because I don't think I still need that. But yeah, it took a year and a half for them to call me.
Wow.
The waiting is ridiculous on all these things.
Yeah.
Same with wound care, that's, it's only one doctor doing wound repairs.
Yes, and his wait list is 8 months to a year.
Yeah, well, it was 8 when I first met him 2 years ago. It was 18 months. So
he brought it
the
down a little bit.
government, yeah, the government gave him more operation time, which
Yeah.
brought it down. So
But
it's a little bit better.
pretty long.
I know, it's sad.
Well, every time I see him, I ask him if he's, recruited any more doctors to do this stuff. And
Well, he was training a couple when it was my turn when I was there. So
yeah, but I don't think they actually have done it yet.
no. Yeah, he's the only one The rest of the doctor, they're just not set up for the paras and the quads.
Well, and he also does burns, eh? Like he knows
Yeah,
what he's doing.
yeah.
He's very, very good. Anything else that people want to chat about? I'm fine. I just wanted you guys to know how much we've done and try and get some direction for the future. See if what I'm thinking of doing is where we should go. And it looks good so far.
I got another thing I'd like to mention.
Mm-hmm.
Like I live in Surrey, very close to Surrey Memorial Hospital.
Yeah,
They got three brand new medical towers there.
yeah,
Most of the doors to the doctor's offices, they're difficult to open. They don't
yeah.
have the push button to open the door.
Uh-huh.
How can these idiots design this medical buildings for handicapped people in wheelchairs or in my case, and a medical that's thing, and
Yeah.
we can't get in the door. We can't get in the office.
You know what? I can't help you there. I
But
don't know what to tell you.
what's wrong with whoever designs this stuff's what I'm getting at. Every one of these medical offices should have a button that you can push to open the door.
Yeah, it should be the same everywhere. Well, it's supposed to be the same everywhere, but
They're
builders
all
changed
supposed to
everything.
have lever handles, and they're all supposed to be
Yeah,
a
but
certain width.
the builders change things because they want to save money, so then they start changing
Yeah,
things on
these are
their own.
brand new buildings. They're only a couple of years old.
Yeah, but it's the builders that change things.
Yeah. And if
Well,
they can beat the building code, they do.
Oh,
Yeah,
for sure.
If it saves them money.
it's terrible.
And I don't think, it saves them money, and I think they just stick with that, let's save some money here.
And like the
You have to,
elevators at Jim Patterson Hospital here in Surrey, time you get to try to get it, when the door opens, try to get into it, the door is already closed.
yeah.
I don't know anybody else experienced that, but it's so fast.
yes,
You could probably ask for that because I think they
in
can change that.
advance.
I think that's a setting.
Yeah, usually I ask somebody else to hold the door so I can get there.
Can I just say that based on the last comments, I think we need to be talking to government standards for accessibility on buildings. Because
Right.
I think you all will agree that what our options are for accessible housing, apartments, whatever, is a heck of a lot less than the average person. Therefore, there needs to be changes to how developers do things. I mean, when you see townhomes attached to a five-story building, and the townhomes have two steps up to the front door off the street level, and then the commercial spaces on the same street level don't have any steps. That doesn't make any sense to me.
No, I agree with you totally. And I tell you, I'm in Vancouver and I am looking for a 3-bedroom place, and it's almost impossible because all the townhouses are going up. They're all like 3 stories high.
Yeah.
3 bedrooms are really hard to find on one level.
And
You
I
got-
will also add to that the cost of building things accessible is no more than building it inaccessible.
That's
There's
right.
no difference. We currently here in Kelowna have a recreation center being built.
Yeah.
They've made it completely accessible. It hasn't been built yet, but and they told us that it was not more expensive.
No, if you plan properly and you do it ahead of time, it's the same price.
Mhm.
All you're doing is putting lever handles in instead of round handles, and they cost the
Correct.
same thing.
And if you do it, everybody can benefits, not just
That's right.
Mhm.
Yeah.
not us.
So I'm
I've
not
said
sure
that.
how Paul, I appreciate that. I'm not sure who I would get for us to talk to.
That's a government standard, so we need to talk to
BC
somebody that
building
writes the
code.
standards for
Building, yeah.
BC building code.
It's
Yeah.
a BC building code is the umbrella. Then it
Yeah.
comes down to each municipality or city. They have their own interpretation of the BC
Correct.
building code under the guidelines.
Habitat
Okay.
for Humanity is building places here in Duncan that do have a variety of bedrooms, including 3.
Yeah, there are a few places that are doing this kind of stuff,
Yeah,
but they're few and far between.
yeah.
I appreciate the ones that are doing it. I know they did some in Courtney Comox too.
Yeah.
but they're not doing very much in, well, they can't afford to do very much in Vancouver.
No.
Yeah, they're
But I
putting a
agree
lot.
with you totally. I would love to talk to somebody who, it's not so much, I think it's who enforces the building codes.
No, I think most
Pretty,
developers do follow it. It's just
Do they?
the building code is built for 50 years ago, and
It changes
it's
every
now
five
been
years.
upgraded to 30 years old.
No, they change
Well,
about every
and I
five
think you're
years.
right. It changes in every municipality because I know that Vancouver actually implemented a universal standard for new buildings, including condos and townhouses. But I mean, they can't make it a universal standard for stairs. But they've made it in say in an apartment building, you have to have lever doors. They have to be so wide, and they have, I think, implemented a requirement for one level 3 bedroom places in a development, but it would be like one of those and 55 of the others.
That's right.
So it's very interesting. I don't know. Like if I get the guy from Vancouver, it's not going to help anybody from Kelowna or or
So,
somewhere else or Surrey.
what about finding a developer that specializes in making the developments that are accessible?
That
They'd
might
be
be an
happy to talk
idea.
about their work.
Yeah, that might be an idea. I could have a look and see if I can find somebody.
Mhm.
It's going to give me something to do, Paul. Give me something to do.
If I can throw in something, I may be able to help there. I have an acquaintance who is an architect who specializes
Okay.
in buildings for hospitals, seniors, and the like. And if he couldn't be the right person, he would probably know who the right person was. So you can leave that with me. I'll get back to you on it in the next couple of days.
That would be great. Thank you.
Happy to help.
Yeah, good job. Thank you. All right. Well, I think I'm going to shut us down on a happy note then.